and the ICMR has a huge amount of funds for millet. Are they good? Are they good as advertised? Is there something different in each millet? Which one we should eat? Or we should tell patient, well, millets are all good, you can take any. This is what Seema is going to tell us. Seema.
Thank you, sir. Very good morning to all of you. So, as health effects of millets, we'll be discussing. So, millets have been an integral part of our diets for centuries, and millets are high energy foods that were domesticated and cultivated as early as 10,000 years ago. So, today India is one of the largest producers of millet. Approximately world's 40% millets are produced in India, followed by Africa. Then with the aim to create awareness and increase production and consumption of millets, United Nations at the behest of Government of India declared 2023 as the International Year of Millets. So 9 important, though there are more than 15 millets available, but globally 9 important millets are cultivated, which are barley, sorghum, finger millet, pearl millet, foxtail millet, barnyard millet, proso millet, kodo, and little millet. So I'll be discussing the effect that has on glycemia as reported in other studies, and also the effect of millet consumption on CVD risk. So this is a study which was a randomized controlled trial of healthy subjects. 16 subjects were enrolled in this study, and the study was conducted in Sweden. Here 96.8 grams of dried barley kernels were boiled in water and given to the participants in the treatment group, and participants in the control group consumed about 119 grams of bread. So what was seen that here you can see the area under curve. Those who consumed barley, the area under curve for glucose was significantly lower than those who consumed white wheat bread. Similarly, for insulin also similar findings were seen, and interestingly there was an increase in GLP-1 with consumption of barley kernels. So another study which was also conducted on barley, the effect on postprandial glucose levels was seen. It was conducted in Japan, and there was a crossover trial. Here barley was mixed with rice, 50% rice, 50% barley, and it was tested against only rice. The control group was given rice. Again here, as you can see, the slightly lower glucose values at say about 90 minutes in people who consume barley with white rice. But importantly, the overall area under curve was significantly less. It was reduced by 25% in those who consumed barley with rice. And this was a study which was conducted on finger millet. The finger millet was given in different forms. It was fermented, and it was given in the form of a dosa, it was given in the form of roti, and that it was tested against white rice, glucose, and that's it, rice dosa and glucose. So here, as you can see, the area under curve was least in whole finger millet rotis. And if you see for glucose, it was much higher. For rice dosa also it was quite high. And then this was a study which was conducted on pearl millet. Here 5 interventions were given: white rice, millet thick porridge, and millet couscous, which is like sabudana consistency which we make, and then commercially made, self-made, and wheat couscous. Here also it was observed that area under curve was lowest in people who consumed millet thick porridge. So a systematic review of 65 human studies, though they are very less studies, and the studies that have been conducted on very small sample size of varied metabolic condition. There is the data is quite inconsistent as far as millets are concerned, but still this systematic analysis is available, and it shows that millets reduced blood glucose levels by 12% with a mean reduction of 16 milligram per dl. And also when we try to understand the effect on postprandial blood glucose levels, so millet reduced PPHG by 15% with a mean reduction of 30 mg per dl, and HbA1c levels also decreased by 15%. This was a systematic review by Anita in 2021. So the effect of millets on hypertension and hyperlipidemia, this systematic review was conducted on 21 human studies of various types of millets. So again, millets were given in different forms. Some studies gave in the form of biscuit, muffin, porridge, and very few studies have compared chapati to chapati, So very limited data in that regard. But this evaluated the effect of long-term consumption of millets. So here, in a sample of 870 subjects from 18 study, it showed that total cholesterol levels decreased by 8%. In 17 studies, it showed that TGs, they decreased by 9.5%, and LDL-C reduction by 10%, and VLDL by 9%. So overall, the beneficial effect on lipid profile has been reported. And coming to the effect on BMI and blood pressure, in BMI, the effect was about 7% decrease in BMI in people who were consuming millets for a period of 3 to 4 months. And also the reduction in blood pressure was about 6%. Again, this was a study which was conducted with foxtail millet. And here also the blood pressure reduction was statistically significant. Now, here is a table where I would like you to focus on the nutritive values and the glycemic index values of different millets. If you see the energy content, more or less the energy levels are similar in whether it's any kind of millet, wheat or rice, not a significant difference as far as the calories are concerned. And if we look at carbs, rice is highest, but the rest of the millets and wheat, there is no significant difference. And if we look at protein, yes, there is some difference. Rice has least, but wheat is not bad. And if we see, the highest protein was in foxtail millet. Similarly, fat content, if we see, again, within the millets, some difference. Pearl millet, highest fat, and then rice, least. We see dietary fiber, even wheat is a good source, but highest is barley. Glycemic index, again, barley least. If we look at the calcium levels, bajra, pearl millet highest. Iron, if we see, barnyard millet. Zinc, again pearl millet. Magnesium, if we see, then finger millet. Phosphorus, wheat. Biotin is a little millet, and then total folates, then kodo millet. So some millets have some qualities, other millets have other qualities, wheat has some other quality. So what is it that, and there is inconsistency as I mentioned in the data. If you look at GI values in one study, they are reported different. For example, for barnyard millet, in one study it is 50 to 65, in another it is 42.3. Similarly, for other millets, if we see, studies have reported different GI values for different millets. So there are limitations, there is heterogeneity in the methodologies that have been used for conducting the studies, and often the sample size that has been taken into consideration is very small, 3 subjects, 5 subjects, like that. And there is a greater variability in using the control food. Some people have used glucose, some have used rice, some have used mixture. So there is a greater variability, and there is a different age group that has been studied, and they have been given in different forms, and role of individual response to a particular food item has been undermined because the sample size is small and it has not been categorized, like type 2 diabetes or pre-diabetes or other metabolic conditions have not been taken into consideration. To conclude, millets are traditional nutritious grains that can diversify staple and the overall diet. They are low-cost source of nutrients like minerals, vitamins, etc. And there's a marked heterogeneity in the study in terms of methodologies. Overall, existing evidence shows that millets play a role in controlling the level of blood glucose levels, lipids, and reducing the potential risk for CVD. Certainly, more research, more RCTs are required to understand the definitive health effects of millets. Thank you.